Yeah, so we have these patients, they come in with these symptoms. Let's say they're diagnosed then with heart failure, heart disease. What are the main treatment options then? What is the next step there?
So, so you have, say, unfortunately, you get diagnosed with heart failure. There are
Mhm.
two kinds of heart failure that we have. One is systolic heart failure, diastolic heart failure. For
Mhm.
lack of time, I don't want to go into the nitty gritty of that or details of it. But say if you have heart failure with systolic heart failure, that means heart failure with reduced ejection fraction.
Yeah.
Um, the symptoms would be people start seeing swelling in the legs, or they can say, I feel tired, I feel exhausted, I feel fatigued, I can't carry on my day-to-day activities, I see my
Mhm.
legs swollen all the time, or when I sleep, you know I'm not able to lay flat, or they say I
Yeah.
need to use like 4 or 5 pillows to prop my head up, or I'm waking up in the middle of the night gasping for air, trying to open
Mhm.
up the window to get a fresh air. So all these are symptoms of heart failure. So at this point, your heart muscle is damaged because your heart is not able to pump enough blood,
Yeah.
and what's happening is it backs up into your lungs, it backs up into your systemic vasculature, and you end up
Mhm.
retaining fluid.
Okay.
Um, is that the question, or?
Yeah, yeah. And so what are the treatment options then for that? Is it medication? Is it kind of lifestyle change that you urge these patients to take? What's kind of the route then that's next?
Right. So it's a very comprehensive thing. And the reason why I went into heart failure is you can have a very complex patient who you need to work with from right from the bottom, right?
Yeah.
A lot of people with heart failure, they don't understand the lifestyle. The lifestyle changes makes a lot of difference. One is, um, I ask them to religiously check their blood pressure every day, check their weight, watch what they're drinking, because when you have heart failure, your heart is overloaded. It can't take much volume. So I ask them
Yeah.
to restrict their fluid intake to 64 ounces or 2 liters a day, which is a lot more challenging because people are used to drinking a lot, right? I mean, when you have a
Yeah.
normal heart, we have we don't have very strong data, but there's a data to show because, and then salt. I ask them to look what they're eating.
Yeah.
I encourage them to eat fresh, if at all is possible, or if they go to the aisle. That's why we have a very comprehensive clinic where it's not only me, but I
Yeah.
have a dietitian with me, I have a pharmacist with me, I have a social worker with me, because I need to figure out what in what way I can help them. I mean, a lot of people can't afford, a fresh diet. So, is there ways and means that we can help them to encourage them to, there are dietitians who take our patients to the aisle and show them how to look at the sodium content in the diet.
Yeah.
Unfortunately, the diet that we eat today is not a healthy diet. So they have to pay attention to that. So lifestyle changes are some of the things that needs a basic education. But I've seen people, the best advantage of lifestyle is people who have heart failure, they go on to retain fluid, and that's what
Hmm.
makes them symptomatic. So they retain fluid in the body. Once they retain fluid, it puts a lot of stress on the heart, and
Yeah.
that's when they have symptoms, and that's when they
Yeah.
come to the hospital. So your quality of life is gone down because you have symptoms. Your quality of life goes down because you come to the hospital regularly. So if we identify these factors and try to see
Yeah.
how we can prevent that, that's a great opportunity for us.
Yeah.
There are a lot more medicines. I mean, the field, 10 years ago, we used to have like maybe 2 or 3 medicines. Right now, we have a wide variety of medicines. So we call them as 4 pillars, or guideline-directed medical therapy. And these are basic medicines that have been there around, but there are some new ones that they've added to the mix, and they make a lot of difference. Like,
Mhm.
I have to explain to you on a common man level. I say, when you have heart
Yeah.
failure, your body is like under stress, and
Oh,
when your body is under stress, your neurohormonal system gets activated. So anytime your neurohormonal system gets activated, it demands more of your heart. It's a it's a response, right? It's a response for your weak heart, because it wants your heart to beat faster, beat a little more stronger. But because your heart function is down, your heart is not able to keep up with that in the long run. So you
Yeah.
need these medicines to what we call check this neurohormone system. So they
Okay.
help to rest and heal the heart. And I've seen many a times people who have both ischemic and non-ischemic cardiomyopathy. That means that people who don't have ischemic heart disease, but there are several other causes for heart failure. With proper medical treatment, you see that heart function restore or get better.
Oh wow. That's
Or
awesome.
even if the heart function doesn't get better, they actually have a good quality of life. They don't have issues with fluid retention and things like that. So that's medical therapy, right? And there is all more excitement in the last 5 years about the device therapies. I mean, a lot of devices have come up. I think we still need more studies to that, but some of the early studies that we've seen have actually shown to improve quality of life. That means that people are able to do more, walk more, feel better. So these are the things that they are focusing on. So there are device therapies that are available, which includes, what the device therapy that we have right now is MitraClip, cardiac contractor demodulation, Barostim, intraatrial shunt. So there are variety of things that are available that we can choose from, and
Mhm.
it all depends on where the patient is and how they're doing.